86% of organizations value professionals that upskill to advance their careers. It's never too late. Enroll for a self-paced online course today and get to enjoy a 10% discount. Our courses are monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal and infant young child nutrition.
Hi everyone, can you all hear me? Hi everyone. I can see Musa. Welcome to this session. Lorna, if you can, I'm speaking. Please confirm if your device is okay. Thank you everyone for joining this session. We're truly grateful and happy that you choose to join this auspicious afternoon webinar from our end. Today will be looking at using theory of change to identify causal pathways even as we move along. And I do hope and believe that we will get to learn a lot even as we proceed. My name is Sheilah. I'm part of the academics team here at Humanitarian Global, and I will be with you through this session where we get to learn everything and anything to do with theory of change. So welcome so much to this session, and looking forward to also getting to learn from you. So this will be a good time for you to just invite your friends, family, colleagues, anyone who's very much into the meal aspect and theory of change to be able to join this session. I want to give a shout out to Abrao Mushivi from Angola. Welcome to this session. We have Abdirizak as well. Welcome to this session. We have Reginald Tinavapi joining from Zimbabwe, who works in the cultural and creative industries. You're very much welcome into this session. So the program of activities will be first getting to learn, to get to say hi to the people who we have here on board. So I'll give a chance to them, to the Humanitarian Global team, who will be able to introduce themselves and tell us a bit about what they are doing. And then from there, we'll have 5 minutes for updates from Humanitarian Global, specifically in terms of what we have in store. And then from there, we will have our speaker for the day who's going to take over the session and, tell us a bit and more about theory of change in the use of identifying causal pathways. So that is basically it. And then once she's done, we will have a chance to have a question and answer session where we'll ask all the questions that we will try. We'll have on the Q&A section, from your Zoom, there is a Q&A section. So if you have any questions, please drop them there. Then once the speaker finishes, you'll have a chance to ask those questions and also a chance to ask a live question. So that will be a good time for all of us to raise our hands. I'm seeing people have already raised their hands. So let's take up that chance to be able to ask those questions then. But then I don't mind saying hi to Abu Bakar and Jonas. Let's have your questions once the expert is able to finish his or her presentation. Thank you everyone for that. So I want to give a shout out to Mohammed from Ethiopia. Welcome to this session. We have Wuye from Gambia. I hope I'm saying your name correctly. Welcome to this session. We have Halimat Jibril from Nigeria as well. Welcome to this session, as well as Francis from Liberia. And I have a lot of my students also in the session. I'm looking at Joyce Mangoma. Welcome to this session. We have Joyce Lona Maru. Welcome to this session. We have Sparion from Tanzania. Godfrey Kaliango. Yes, an MIT student from Victoria. Welcome to this session. As you say, theory of change has been my hard area, so I believe we will make it a little less hard for you today. And then we have Hamid Afridi from Pakistan. Thank you, everyone. With that, I think I want to bring on board my colleagues to also say hi to you guys, even as we proceed. Let me confirm that my speaker is there. Linda, yes, we'll put you as a panelist so that now you can be able to do that. So with that, let me invite Anthony to introduce himself. Welcome, Anthony.
Thank you so much, Sheila. Hi, everyone, and thank you once again for connecting to this session this afternoon. It might be morning based on where you're connecting from. My name is Anthony from the academic support team. Looking forward to interacting with you. And in case of any questions, any challenges, just chat us on the chat section, and we would be there to support you. So I'll be coming back in a short while. But for now, thank you so much, Sheila, for the opportunity.
Thank you for that. My other colleagues, she's yet to join. We have Linda. So I'll want her to just say hi. I don't know if she's able to. Anthony, if you can be able to give her the rights to just say hi, and then we can proceed. And then from there, we'll be able to work around it. Brian also is also part of the team who will also be able to introduce himself and then be able to proceed. So with that, as I work through everything else, allow me to bring on board Anthony to be able to give his.
Thank you, Sheila, once again. So I'll try to be brief as you wait for Linda to connect. And this is sharing with you some of the upcoming events at Humanitarian Global so that you can take note. I know today's session, we might not be able to cover like everything, even when it comes to theory of change. But we do have so many workshops, so many training programs that we do offer. And that is what I would like just to share with you in a brief manner. And just to do that, I would like to project my screen here. So let me just try to do that now. I hope we can all see the screen. Okay, that's good. So you may let me know on the chat section as we move on. So this is our website, just quickly, and you might be interested in monitoring and evaluation courses. So we do have the online courses, which we do encourage you to go for. We talk about the certificate course in MEAL. We have the diploma course in MEAL and also the postgraduate diploma in MEAL. So for you to access those courses, you can come to the Train with Us, and then there's a link there for online courses. And that's where you're going to find them. So for the theory of change, we've been able to cover this concept in our diploma course. So once you come to, so this is what I was saying about the online courses. We do have the self-paced online courses, and I'm happy to see that some of our participants in today's session, they've been able to undertake these courses. Some of them, they're also ongoing in terms of studying these courses with us. So once you come to the monitoring and evaluation, there's a link there. It's going to open the different levels that I did talk about. And quickly, you'd be able to click on one that you would want to go for. View the training outline. Let me just, for example, take the diploma course in MEAL. You'd be able to find more details there. You can have a look at the course objectives. You can have a look at the course outline, and then you can go ahead and make the application. Also, alternatively, just to make it easier for you, you can chat with us on the chat section. Let us know the course that you'd want to do, and our team is going to be there to assist you. In addition to that, we do have training workshops, and there are quite many of them. Like for the month of October, we do have upcoming training. Next week, we're going to be having writing winning proposals for donor-funded projects. So that is a 1-month course. We do also have the social behavior change communication again, starting the upcoming week. So you can be able to register for these courses there. In addition to that, we do have upcoming training in the month of November. So that is the first week of November, the first 2 weeks of next month. That is going to be on data collection using COBOL Toolbox and also Open Data Kit. So you can be able to go ahead and register for that. We do also have data analytics and visualization using SPSS and Power BI as well. That is happening in the first 2 weeks of next month. So you can also register for that course. And maybe just quickly to show you how to go about it. It's very easy. Just click on the course that you'd want to attend. And then if you're joining as an individual, you can be able to use that option there. If you're joining as a group, you can also use that option for you to register. So we look forward to having you register for these courses, and looking forward to having a great time as we take you through these training packages. As I wind up in the next 2 minutes, we do also have some courses, some training workshops scheduled for the month of December, and that is a fundraising and resource mobilization. That is one of them, together with the leadership and project management for NGOs. So for these programs, you can be able to go again there and be able to view the course outline. You can also be able to view the program for that, and also for the fundraising as well. However, my colleague is going to share a simplified link with you on the chat section where you can access these events, comprehensive details about the events. And for these training workshops, we're going to be doing them in 2 ways. So you can be able to come over to Nairobi, Kenya, where we are based, and attend the physical training classes, the workshop physically in person. And we do have more details on the website. You can see the time is peaking there because it's going to be happening from 2nd of December all the way to 6th of December. So we look forward to having you in Nairobi. So much details, all the details, you can find them there. And it's easier for you to also do register for the same. So we have made it easier. And through the links that we're going to share on the chat section, it's going to be easier for you to register. Finally, we do also have the leadership class. Again, this is happening in the month of December, the same dates. So 59 days to go. So that is from 2nd of December all the way to 6th of December. And that is for the on-site class, and you can find the details there as well. In case you'd want to do the courses, the training workshops online, there's also that option at a lesser fee. So feel free to engage with us on the chat section, and then we can be able to guide you further. I might have been quick, but you don't have to worry. We're going to share all this information with you. That was just a brief for you to know what is upcoming. So many workshops, so many courses. This is a one-stop place where you're going to build your capacity, you as a humanitarian and a development practitioner. So thank you so much for the opportunity. And I'll be waiting to hear your queries on the chat section. Our team is ready. Reach out to us. Let us know what your team wants to train on, and we are going to accommodate you and guide you accordingly. So thank you so much for the opportunity, Sheilah, and back to you.
Great. Thank you so much, Anthony, for that. I want to give a shout out to Christella from Senegal. Welcome to this session. We also have Nasa from Yemen. Yes, so those are the two I've been able to pick. Thank you everyone for all that. I want to now give this chance to our trainer to be able to get to introduce herself and be able to take over the session. So I hope you're all loud and clear and ready to proceed with what we have in store for today. So with that, Linda, the floor is yours. Welcome.
All right. So good afternoon, everyone. Thank you for joining. My name is Linda Obura. I am a project management expert with over 14 years of experience in project management and public health, and have managed donor-funded programs for several years. So I bring experience from those 14 years to be able to just assist us to learn a little bit on monitoring, evaluation, accountability, learning, and we'll touch about a few documents that we use in monitoring and evaluation, and theory of change being one of them. I'll try and share my screen. Please put your questions on the chat, just as Sheilah had mentioned. My name is Linda Obura. I am a project management and public health expert with over 14 years of experience implementing, managing donor health funded programs, and I bring in experience of monitoring, evaluation, accountability, and learning, and project management for today's session. So I'll try and be very fast because we have lost a few minutes in trying to get to be able to share my screen. If you have any question, please just put it on the chat. I'll be able to answer after that. So for today's webinar, we are doing monitoring, evaluation, accountability, and learning. First, we need to understand what monitoring and evaluation is so that we are able to understand where we are coming from and what we mean by monitoring and evaluation. So monitoring and evaluation is a process by which we collect data, we analyze consistently, progressively as we implement our projects to be able to inform either our projects or programs, and policymakers to influence the decisions we are making for the projects or programs we're implementing. Monitoring is continuous routine data collection just to measure progress towards results or progress towards achieving your deliverables or what you set out to do. and process evaluation during implementation. So evaluation is basically measuring how well you are actually meeting your objectives, and if there are any changes that can be attributed to your intervention. On this slide, we just have a cartoon to show why it is important to plan monitoring and evaluation. And the cartoon is basically about an employee who is working and does not have a measurement of how much they should accomplish in any day. And so in that case, they're wondering, how is my impact going to be felt? How are the deliverables I am giving into or contributing to going to be measured? Or how can we understand what I am doing? So at some point in the work, the employee decided, let me try something. Let me see if I go home early, if the boss can actually tell the difference. So how do we measure what we're doing and if we are contributing to any changes in the work that we're doing as program managers, as project managers, as monitoring and evaluation experts? How do we measure and how do we attribute the changes to the implementation that we have been doing? So it is important to monitor and evaluate progress so that we can be accountable. Accountability is to our communities, the individuals, the development partners that we work with, so that we are accountable in terms of what funding we have been given and what results we give for the same. Learning and continuous improvement, then we have communication. And for us to be able to realize the benefits of evaluation, it is important to be able to plan early and ensure that we engage in both monitoring and evaluation while the project is ongoing and in progress, and not only after it is done. So as we do monitoring and evaluation, we need to identify our goals and objectives. What is it that you want to achieve? What is it that is going to lead you to the goal or the impact that you want for the solution that you have proposed for your problem or for the projects that you're working on? So it could be an intervention, and the intervention can be across all sectors: conservation, education, health, wash, water and sanitation. So what are the goals? What are the objectives? What is it that you want to achieve with the project that you're implementing? What are your performance indicators? They could be qualitative or quantitative. So quantitative is a number. Qualitative is actually a change that you can see. And then define your data collection methods with the specific timelines. So if you need to do a pilot project or you need to do a survey, so how are you going to collect your data? Within what timelines are you going to be able to collect your data? What are the roles and responsibilities of your specific team members? Do you have any analysis that needs to be done? Do you have softwares that are going to be doing data analysis? Do you have softwares for reporting? What is it that you're going to utilize to be able to analyze the data that you have collected? And then how are you going to report the implementation progress, data results? How are you going to report them? Do you have any templates? Do you have any specific templates? Or you're using the templates for the development partners? What are your monitoring timelines? The monitoring timelines are basically what cycle are you going to utilize while you're doing your monitoring? Would it be monthly? Would it be quarterly? Would it be annually? So some of the documents that we use in monitoring and evaluation are the logic model, which I had someone ask about a few minutes ago. Then we have the theory of change, we have Gantt chart, and we have evaluation plan. So as you do in the project cycle, normally we have planning, we have conception and initiation, we have planning, we have execution, we have monitoring and evaluation, and we have closure. So in all those 5 phases of project planning, or rather of the project cycle, normally there is processes towards monitoring and evaluation. And that is where you do the monitoring and evaluation plans. That is where you develop the plan. And the plan is to help you as you're implementing to be able to report on the progress, either yearly, monthly, quarterly, or depending on your timelines for reporting. So every intervention should have an M&E plan. The document details your objectives, what are the processes and what are the procedures that you're going to follow for the intervention, or for the implementation. And they also show what are your expected results. You have your goals and objectives. So what are the results that you expect from the activities that you're going to implement under your specific goals and objectives? Any data needed and sources of those data should also be put in the M&D plan. And it is done just as I had explained during the design phase of the program or the intervention. And when I say the design phase, I mean both at proposal writing stage and at conception and initiation. In that M&D plan document is where you will also have or show how your program project intends to measure achievements meetings. When we come to the M&D documents, we are talking about the documents that we have already mentioned, which is the logic model, the logical framework, the theory of change, work plan and Gantt charts, which are used interchangeably, similarly to the logic model and logic framework. And then we have evaluation plans. Remember, I had mentioned something about the definitions, or rather about the terms that we use in monitoring and evaluation. So we have inputs. Those ones are the resources that we're going to be using in our interventions. The inputs can be people, they could be partners, they could be products, they could be anyone that you'd like to be collaborating with in your project will come under inputs. Then activities are those things that you will do. What are your strategies? What are the techniques you're going to be utilizing in your interventions? The techniques could be trainings, they could be capacity building. The techniques could be supporting with, for example, if it is conservation, tree seedlings and stuff like that. So what is it that you're going to do under your objectives as activities? And then we have outputs. Those are the immediate results of your activities in your intervention, and the outputs are measured in terms of volumes. So for example, if you're doing training, and the training we are doing for stakeholders in the community for conservation, and so we say we are going to capacity build or train 100 stakeholders on conservation in a certain place at a certain, or rather within a certain period of time. So then we say the output there, the direct or immediate result will be the number of people trained. When we come to outcomes, outcomes basically mean what are the changes that we would like to see in these individuals or group of people or programs within a certain period of time. So the difference between outputs and outcomes is that outcomes is change over time. Outputs is actually the immediate result of the activity that you're implementing. When we talk about outcomes, we can divide them into three: short-term, mid-term, and long-term. So in terms of knowledge change, for example, the example I gave on conservation and capacity building, when we talk about short-term, we are going to say improved knowledge or skills. When we go into mid-term, we will begin to see, is there any change in the community that we have been capacity building on conservation? So have they been able to be building trees? Have they been able to stop cutting trees and stuff like that? So that's midterm. And then long-term is the changes that occur over a very long period of time. And there are changes in norms, in practices, in beliefs, in policies, in organizational behavior. So those are the long-term outcomes. Then finally, the impact. The impact is the overall goal of the project actually achieved. Then when we look at performance indicators, these are the measurements, and the measurements are how are we able to measure the performance against the targets and the objectives. So those are the things we call performance indicators. Additionally, in definitions, we add definitions on data. I had mentioned about qualitative and quantitative data, and data is specifically the raw facts or statistical analysis. An indicator, as I had mentioned, is a means of measuring the actual result against the planned or expected result. And this comes in terms of either quantity, quality, or timeliness. So I give an example of a logic model. And when you want to prepare your logic model, you ensure that you start with looking at your, or rather when you're doing your M&D plan, your work plan, and your Gantt chart, you have to look at your logic model. So the logic model is a diagrammatic representation of how your project will move from point A to point D, for example, which is the impact. So it shows how the inputs feed into the activities, how the activities fit or feed into the outputs, then how the outputs then move to the outcomes, and finally the impact. In this next slide is an example of a child mortality intervention, and we can see under the inputs what we put, under the activities what we did put there, and then how the activities now move into the outputs. I will just go across one line so that we can get back a few minutes of our time. So the first one was integrate nutrition in 10 district health facilities. That's the activity. Coming into the output, we have 10 district hospitals actually integrated or integrating nutrition services for children under 5. When we go into the outcomes, normally you could have short-term outcomes, you could have outcomes that are over the period of time of implementation of your intervention. So for this one, apparently, we have increased awareness of primary caregivers on importance of quality prevention nutrition services. And when we go into the impact, which is the overall goal actually achieved, we say it is reduced child mortality rates and improved quality of life of children under 5. So the logic model helps you to plot your intervention from the time of the resources that you'll be putting into your project and your activities into the outputs, outcomes, and impact. So it gives a diagrammatical representation of the relationships. The next one is an example of a work plan or Gantt chart. Normally the work plan and Gantt chart also plots your specific objectives, your activities under those objectives, and then it gives a plotting of time when you're going to be implementing whatever intervention you're implementing. The only difference with this is that at the end of your diagram towards the right, you add columns to say directly responsible individual, who is responsible for those things that you are actually going to be doing. Is it one of your team members? Is it a different team member? So you need to put that there under the directly responsible individuals. So these are just examples of Gantt charts. This second example is an example of a business plan. And you can see it has all the objectives of what needs to be done for the business. It has the time from start to finish, and then it's plotted across 1 month to be able to see what needs to be done within that 1 month. And you can see they are plotted as almost as a graph with different colors, just to show us what needs to be done at whatever point of the work plan. Next, I give an example of the evaluation plan, which we also develop when we're doing monitoring and evaluation. And in the evaluation plan, as you shall see across the columns from A to column H, at A, we have the expected result, which is the output or outcome from the logic model. Remember, the evaluation plan is developed from your logic model. So from your logic model, you have the output, you have the expected results. So you plot them also against this template. So you put outputs, as you can see, we have short-term outcomes, we have mid to long-term outcomes, and then finally we have the impact. In the evaluation plan, you will put your indicator, which is the measurement, the standard of measurement. So I'll give an example of the second one, 1,000 community health workers trained using that particular curriculum. So the indicator for this one is the number of CHWs trained. You need to add in your baseline data. Baseline data is what is your reference point? Where are you coming from? Are you coming from a situation of not even one community health worker being trained, or are you coming from a situation of probably continuation of a training of some sort? So our baseline data on this one was actually 0. So you put it there. And then you put in your timing for target. How often are you going to be evaluating or monitoring your progress on this one? And then next is achieved towards target. What is your data source? The data source for this one would be the attendance sheets for community health workers, and then the directly responsible individual, and then finally collaborators. Who are you working with? Do you need external partners? Do you need only your team members? So that's an example of an evaluation plan. I would like to give an example that has been filled. When you come to this next slide, you're seeing the oval red circle. So that shows baseline data for knowledge increase. And the baseline data at that point, for example, if we do a pre-test during a certain training, we see that on average, the community health workers answer 65% of the questions correct. However, when we go towards achieved towards target, we see that there is a 25% increase in knowledge from the pre-test to the post-test. So averagely, we see that after the training, 90% of the CHWs actually answered the questions correctly. So that's achieved towards target, and that will show an increase, or rather it has measured an increase in knowledge, which is actually a change. So when you're doing your evaluation plan, ensure you have what is the expected result, one, what are the indicators you're using, what is your baseline data, what is your timing for the target, is it monthly, is it quarterly, is it annually, and then what is the achieved towards your target. And then now you can do the data sources, the directly responsible individuals, and who are their collaborators. As we move closer to finishing, we go into the theory of change. And the theory of change is basically a visual document that shows us what the change or solution we are expecting. And then it explains the how and why the change is about to happen. So this explains what is the assumption. What is the assumption you're making that the change you actually want to see will happen from your intervention? And the theory of change is utilized for program or intervention planning, mostly at the initiation phase. And then it helps us identify the preconditions for the intervention success, giving us a lot of clarity of where we want to go, what we want to do, and why we think what we're going to do will be influencing change in the communities we work in. Most organizations use the theory of change to be able to get buy-in from our stakeholders or from development partners. And the theory of change actually helps us to pitch what intervention we are actually proposing. So for us to be able to prepare a theory of change, we need to identify the problem, identify the solution, what is the impact we want to see, what are the outcomes we are looking at, then what are the activities we'd like to do and their outputs, and then identify your resources and articulate your assumptions. So we usually talk about the spheres of change when we're talking about the theory of change. We will look at what the spheres are shortly. So when you're developing your theory of change, you need to, number one, understand how the change will happen in the context of where you're working in or what you're working on. Next, you identify your specific roles in contributing to that change. You next develop a conceptual pathway that will illustrate how your efforts contribute to that identified change or the expected change. And then what are your assumptions? And the assumptions will need to be tested during the life of your program. Then finally, continue monitoring the change and your change pathway, and then test your assumptions and see if your assumptions were actually correct, that there'll be change happening. Then finally, critically reflect on your pathway and see if your role was very important or is important in the change that you're seeing. So when I was talking about the spheres of change in the theory of change, we have three spheres, and those three spheres are the sphere of interest or sphere of concern. It's a cyclic process, and the sphere of interest or concern basically involves structural change, and these are the change in the lives of people and the conditions of the society, and sometimes represents the long-term changes beyond the control of anything or anyone. So this change is not something you can control. That's why it's called the sphere of interest or sphere of concern. And then we have the sphere of control. The sphere of control is where you, as the program implementer or the program manager, has a direct control in your program or in your intervention. And the things that we have control over in our programs are the inputs, the activities, the outputs, and the resources. So how are we going to use the spheres of control that we have to be able to influence sphere of interest or sphere of concern? Where sphere of concern or sphere of interest is where you have no direct control. However, it shows long-term change in the communities or societies that we work in. And then spheres of influence is beyond your control as the program. However, you cannot control the action of other actors, but the program is still able to influence the outcomes of your intervention. So these spheres are actually interrelated and they rely on each other to be able to achieve any change in your community through the intervention that you're implementing. The next slide is just an example of a theory of change by USAID. And you can see from your extreme left, there's something about conditions improvement and where they would like to see their staff move towards the top right corner where we have an intention of having front runners in USAID staff who express an openness and curiosity for innovative design. So for us to reach there, there's the sphere of control, as you can see. There's the sphere of direct influence where we have direct control over something, and then actually not direct control, but direct influence over something. And then the sphere of indirect influence, and then finally the sphere of interest, just as I had explained in the previous slide. The last one is basically also an example of an adolescent girls and young women project, which is the DREAMS project funded by USAID. This is their theory of change, and the theory of change here shows that we want to reach out to adolescent girls and young women as our core beneficiaries of the intervention. Among, or rather within the communities we are working in, these adolescent girls and young women are actually influenced by various other factors, either their families, their partners, and the communities that they live in. So we need to be able to see where we have control or not, and what we can do to actually influence the change that we'd like to see in the adolescent girls and young women. And the changes we'd like to see are towards your extreme left, where we have safer sexual behavior, social protection, and biological protection from HIV. So for us to be able to achieve all those, we need to be able to come up with interventions for everyone around the sphere of influence of these adolescent girls and young women at the center, so that we can be able to have a change in either behavior as the sphere of interest and concern. As we finalize, please remember, monitoring is continuous and systematic. It is analysis and reporting of data about your progress. It can be used to track changes in your performance, and it can be used to determine if the activities you're implementing actually need any adjustment or improvement to be able to elicit or actually enforce impact in the communities that we're working in. Evaluation in itself measures how the project activities have achieved their objectives and how the changes have led to outcomes and how those changes can be directly linked to the intervention. The evaluation measures the impact, which is the difference in the outcome of interest between having or not having the program or intervention. And then we can look at a correctional view if there's something that we need to change within the intervention, because probably somewhere along the line in the intervention, we noticed that something was not working, or one of our strategies was not actually smart and could not achieve the objectives that we intended to. Finally, monitoring and evaluation is the process by which data is collected, analyzed, to be able to give strategic information to policymakers and others for use for decision making. And the essential components of an M&D system are the indicators, the data that we're going to collect, analysis of that data, and being able to present that information to actually inform decisions. Thank you. Sheilah, back to you.
Yes, thank you so much, Linda. We've really dwelled a lot on aspects of monitoring and evaluation, and we have a few questions based on what you have been able to treat. about and what we were hoping we will get to receive. So the first question is, how different is TOC from expected outcome? How different is TOC from expected outcome? You heard my question?
Yes, so I'll say TOC, which is the theory of change, is a document that we use when we are in the design phase of the project. And the theory of change is utilized to show us our assumptions or how we think change is going to happen. What are the causes of that change? What will influence the change that we'd like to see? Whereas an outcome is actually the change that we are looking at. Yeah.
So the outcome is the change that we're looking at. And now when you look
Yes.
at, if you're now told to clarify between an outcome and an impact, which are the best words that you can use? An outcome and an impact.
So the outcome leads to the impact. So the impact, the impact is actually achievement of the goal that you had set out to achieve. So if, for example, in the child mortality intervention example, you had stated your goal as to reduce child mortality cases of children under 5 in a particular region, either by 5% or 2% or 20%, through improved nutrition services in the facilities. So the impact there will be the 20% reduction in child mortality. However, for us to reach that 20% in child mortality, we have to, one, train either the healthcare workers on nutrition. Two, we'll have to train the caregivers on nutrition or supplemental nutrition if they are not able to afford, or whatever, like vitamin A supplement, which is usually given during clinic. So those are the processes we undergo to be able to achieve the changes. But for us to achieve that 20% decrease in child mortality, there needs to be a change in how caregivers and service providers actually do their work. So if we have caregivers who ensure that their children are actually given supplemental nutrition, that's an outcome from the project. Yeah, then the impact is now the 20% reduction in child mortality. That's why we usually have baseline data to see where we are coming from to be able to achieve that percentage of 20% I'm talking about. I don't know if that's clear.
Yeah, that enables us to see the difference between the two. So someone was asking a question in terms of the logic framework. Can the horizontal and the vertical grids change? Because I think you feel that you change the format. Can they be changed? Or you can alter depending on the project that you have?
Yes, the templates normally differ depending on whoever and the development partner you're working on. You're working with, you can change, you can alter your template as per your needs, but ensure that in your template you have your inputs, outputs, activities, outcomes, and impact. Some actually use the problem tree to show how the project will be implemented and how those things feed into each other.
Okay,
yeah,
that makes sense. That makes sense. And another question would be, I'm trying to hurry up. Someone has asked, when now you look at the logical model, the theory of change, the Gantt chart, and all these other tools of monitoring and evaluation, used for all projects, or you can use based on the type of project that you're currently undergoing? You have to develop all of them, or you can choose the one that works for the project.
So you can choose the one that works for the project. Normally it is prescribed by your development partner, what you need to utilize. But as an organization, you also need to have a say and say, we have all these documents developed, and sometimes documents feed to each other. Yeah. So the theory of change, the theory of change will help you to show the causes of change and how you think your project will be able to influence the impact. And then the model will help you to plot how you're going to actually do your implementation and how one thing leads to another. And then the Gantt chart and the work plan are normally used to plan your work against the timeline or when you're going to be implementing, and they will show the person who is responsible. And then the evaluation plan is utilized to evaluate your project and see progress. Yeah, so all of them are important. It depends on what program you're implementing. All the requirements and terms of reference are different for every project.
Okay, thank you for that, Linda. I want to give John Scarius a chance to speak. So, Scarius, could you unmute and ask your question? Okay, as John prepares, let me give a Menti. Menti, could you ask your question?
Okay, thank you for your well-organized presentation. I would like to ask a question on the logic model. Can we integrate multi-sectoral projects in one logic model template?
Sorry, I didn't understand that very well.
But as per the information I have here, is that you're from Ghana.
Please repeat your question.
Okay, thank you. I would like to ask on logic model, how can we integrate multi-sectoral projects in one logic model template while we prepare M&D plan?
Yes, you can integrate in one logic model and put under the activities, you can have several compact, like buckets of specific activities or other buckets of specific sectors of your multi-sectoral project. So you can have it in one document. Yes, it will be a very huge document, but make sure that everything for one sector goes into different buckets. So you can separate them under the activities. Then you move through one sector into outputs, outcomes, and the impacts. Then you move into the other sector like that. So you can put them in specific buckets.
Okay, so I have a question. Like, we were expecting to see or design a good theory of change. So we will make a point of including samples of recent TOCs developed, and then we'll share with you guys. So in the presentation, you will find some of the samples and examples of theory of change that you can use. Okay, I hope that's okay, because I'm seeing a lot of us want examples of a TOC. Then finally, I think I'll ask this question. Can you explain the two types of risk and the main types? And is it
Sheilah, you're disappearing.
I'm saying, can you explain the two types of risks and assumptions in project? And is it a must for every project to have baseline, midline, and endline evaluations? Normally, most projects can have baseline, no midline, or endline data. Clarify on that. Have you heard the question?
Yes, someone is talking about someone is talking about two types of risk and assumptions. I don't quite understand what you mean by the two types of risks, because risks is a whole different other topic when we talk about risk management. And we could be talking about risks which are external, internal. We could be talking about risks which are financial, strategic, human resource. So someone needs to explain that question, but we can tackle that in a different class. Okay. Assumptions are just what you think will be able influences the change in your intervention. And then finally, do we have to have baseline, midline, and endline evaluations? It is not a must, but it is important, because then as you go through your project, you're able to see if there's any change that needs to be done. And so you do the change timely so that it doesn't affect the delivery of your intervention. Some projects will do only the baseline and the endline evaluation. Others will do all of them. So it also depends on what kind of intervention you're implementing.
Okay. I think that's basically it. And then finally, this is my last question. At what stage do you decide on your evaluation methods, that is RCT or other experimental methods, TPA, IPE, or a combination of all? Is it during the planning phase, or where is the best stage where you decide on the evaluation methods to use?
So you decide your evaluation methods at the conception stage and the initiation stage. And also at the conception stage is where we do the proposals. So as you're doing your proposals, that is when you will decide what experimental tools you're going to use.
Okay.
Yeah. So you can't implement a project and get to midline which tools or which plans you're going to utilize. It has to be done before.
Okay. Okay.
Yeah.
Okay. Thank you. Thank you, everyone. I think we can try and end there. I don't know if there's any burning question. MacArthur Marshall, let me give you the chance to finalize this session. MacArthur Marshall, could you ask your question, comment, or clarification as we wind up? MacArthur Marshall? Okay, okay. Because I had Omaru Kanu. Omaru?
Yeah.
Could you ask your question?
Okay. The presentation was explicit. The touch every area.
Okay.
But what I want to ask, monitoring is very important in projects, and sometimes assumption also, because many project managers see the assumption and they continue doing the project. So why do project managers fail after they see the assumption? Because, for example, assumption can be environmental assumption, like what are the difficulties that will affect the project in a particular environment. So the manager has already seen that if we develop a project here, it will affect due to flooding, and he continue doing the project again. So is it greed or selfishness that leads to the failure of a project after the project manager have already seen the challenge and he know that if he implements the project, he will not succeed? Is it greed or selfishness?
I would say that yes, it could be selfishness or it could be selfish interest, but before I say it is selfish interest, probably there are needs of that community that whoever it is as the project manager actually sat down and so there is a need here and we need to implement an intervention. However, if it is basically for selfish interest, of course, there's a problem there. But before you do any intervention, you need to have done your needs assessment to find out if whatever you want to implement as an intervention is actually needed by the community that you're going to work in.
Okay, thank you. I hope, Omaru, your question has been answered and you're okay?
Yeah, my question has been answered.
Good, thank you. Thank you very much. Do I still have MacArthur? Okay, so basically, I think that marks the end of our sessions. I know there are so many questions on the question box and they're very important. So Linda will be trying to type them in to each question as we end the session. So now, if you had your question, you can still get your question answered. Better still, please join our Discord platform where all these questions will be posted on the Discord platform with all the relevant answers towards the questions that you asked. So we'll share the link for you to join on our chat so that now you get to join the platform where you'll get to learn more about everything and anything to do with theory of change. And if there are any upcoming trainings that will help us be able to better understand what theory of change is all about, that would be the best place where we get to see that. So with that, thank you everyone for being here, for being attentive, for learning, and for even all the questions that we've had. We truly appreciate all of them and looking forward to seeing you in our next webinar session. Thank you everyone and goodbye.
My name is Evans Chepkwony. I'm the Operations Director at Beam Children's Foundation. a non-profit organization working in Tarbo, Eldoret, Kenya. We provide educational scholarships and mental health counseling to vulnerable children in the slums within Tarbo. I learned of Humanitarian Global through a friend and wanted to do a training on leadership and project management. And I got a chance to attend a training, a 4-day training on project management. And I've learned a lot. My take home would be the change management and communication that I intend to put into work once I get back to my workstation, and see to it that this improves the services that we deliver to our clients.